your company markets itself as, AI driven. And so what are you seeing with AI in healthcare? What do you think what's happening today and what's going to happen? Do you think, be a futurist? What do you think is going to happen?
So there's a renaissance happening right now. Healthcare is a gold mine for AI because it has decades of data that up until some of the recent model changes have been unusable. And now because of, you have the different LLMs, different ways of training specifically unstructured data, I think we've been able to deal with structured data for decades. That's not new, but our ability to use unstructured data is a huge unlock. And you're seeing AI scribes, it's really in the workflow automation right now.
Right.
But now we're starting to see it and creep into clinical. My hot take is we will see an AI PCP, a primary care physician. And I actually look forward to that day because I don't really like going to the doctor, if I must be honest. Like the only thing is like, do we have a higher bar on trusting AI than we do a human? And the biggest question in my mind is, what does safety look like? How do we prove that this is doing what it's the AI's recommendation or prediction or whatever is
being
good for us?
Yeah.
Yes. And that's uncharted territory. And I don't think it's a solved problem yet. So that's probably the biggest blockage point of that plus human emotion. Actually, the AI already can beat the doctors and practitioners in some things, not everything, some things, but humans get tired. Machine doesn't.
Well, I mean, the interesting thing about AI in terms of knowledge, and it's not even so much the tired, it's that a doctor spends, years, sometimes decades, specializing. And they know that area of the body really, really well.
100%.
The problem is that like the body is a system, and you might have a problem happening here or a symptom happening here, but it's actually getting kicked off somewhere else. So, I mean, I definitely had that when I had colon cancer. And I had continual infections elsewhere in the body. Like there was one particular part of my body where I was continually getting an infection. And like I could have spent forever. Like I would go in, they would look, they'd put me on antibiotics. They had no idea. They were guessing why. As soon as the tumor was removed, infection gone.
You know what I love though, so the medicine, all right, in my story, a hospital here in California offered my partner up and a robot surgery driven by AI, and like tried to sell it. Like they were like, this is so cool. And it's a major academic center. So, and his response was, no, like I just want a human. Because, you don't want to be first, right? Like I just said, I look forward to the day where there's an AI PCP, but I will not be the first adopter. I will be like maybe the hundreds or thousands.
I think you kind of almost it's almost like the driverless cars.
Yeah.
There needs to be a time period where there are humans that are there to correct it's a new technology. New technologies are never flawless. And so you need a human there until like we have some confidence that the car can actually drive itself, or that the surgery can actually go on its own, on itself.
Yes.
But I do find it really like the database idea and AI being able to sort of connect the different systems in a way that a GP tries. And if you have a good GP, they're probably really good at it.
Do it.
Yeah. But it can be hard to even get into a good GP. Like we have layers now in between. And so of people who've spent less time studying the human body. And so the AI kind of helps maybe give a more overall view, whereas the human, it serves also, I think, as like just getting comfort and feeling a human taking care of you. Although there is some research out there that shows that we're connecting to AI just fine. I don't know. We'll see.
Yeah. I love though, I saw my parents do this, where before a doctor's visit, you run in your questions and into ChatGPT or Perplexity or whatever your platform of choice is. And then you can tell it, like, explain to me like I'm 5, or tell me questions and indicators of that I should ask my physician. And that's the part I love of helping consumers feel a little bit more powerful, or
It's reducing the knowledge asymmetry, which
100%.
which I understand, like, getting questioned really throws off experts and they, especially doctors, because like I think for so long, we're just kind of used to, like, the doctor tells you to do something and they have so much more information than you that you just sort of take it. Like, but I think it's an important thing that is happening because the systems are built now because of the way that hospitals, healthcare gets reimbursed, where, really the physician has 15 minutes with you. And a lot of the time I feel like they just don't, it's not that anything to do with their abilities, but I'm not sure that they actually have the time to thoughtfully think about you. So you have to thoughtfully think about you before you go in. And yet you're not qualified to thoughtfully think about you. And so that's where I could see, like, the AI being helpful. But I am positive that healthcare is not going to like that.
Oh, I don't, and I'm here for that. I love that. So I don't particularly care. I love, have you ever noticed radiology reports in particular have so many double negatives in them? And so it's like, whoa, I like the LSAT is less complicated than this. But it's like their way of talking, right? It's
Oh yeah, they have a jargon for sure.
Yes. And so like you run that through ChatGPT and like you all of a sudden you're like, okay, this is an intimate conversation happening about my body that I'm finally invited to the table to discuss.
To understand. Yeah.
Yeah. So I think that part is good.
There's a funny story about that somebody I've worked with, and basically because of my chart, the person who was very much in shape, they were actually in one of the military services. So they were in very good shape and clearly valued that. And so anyway, as part of the assessment, the notes were abs unremarkable, which in doctor speak just means nothing's going on there. But they saw the remarks in my chart, and they came back really upset because they thought their abs were remarkable. And I love that story. It makes me laugh every time I think about it. But that is the kind of thing that, like, AI might be able to be like, no,
they're just saying it's normal. You're good.
They're just saying you're good.
Yeah. Yeah. Well, I think there's a whole healthcare future coming, and it's the technology's here. And where I sit, what AI means more personalization, AI means precision medicine. That level of personalization exists.
Yeah, I think that's the challenge with the system, is that, like, it's not just one part of the system that can change everything, but AI is certainly a big force. And then how people interact with it. So you've got, like, kind of two components that are going on, like the capabilities of what can be done and then how the people are interacting with it. And then that drives what all the other players' reaction to it. But you almost kind of need an external catalyst, and AI might be it.
AI is a more profound change in society than any of us might realize. I think it's changing already how we consume information, how we validate it's true, which means it's changing how we distribute product and go to market and sell and interact, and changing how we move here in the city of San Francisco to an extent. And there's more coming for sure. So, and it will change. It's changing healthcare. I think we're in the beginning of that. It's way easier to tell, to measure a car and say, like, is it safe, right? Is it like following the track versus like measure AI across a diagnosis or recommendation or an action.
Right.
Which one on the human body?
If it's done right, we would be early, or we would be so early that we would actually prevent problems. But then, like, there's no measurement to show success, right? So when nothing happens, nothing's counted. And,
Yeah.
And so, you know, it's hard to measure what doesn't happen, is what I'm saying. And yet that's where the possibility is. It could get involved so early in the pipeline that it's like, listen, every time you eat that bag of chips, this is what happens to your body.